What's going on, YouTube Nation? We have a HOP patient ready to be served, so let's serve him with a smile. Let's not waste any time. First and foremost, we must always make sure, before we draw blood, to correctly identify the right patient. There are instances where patients can share the same first, last, or even both names. It is possible.
Paging Dr. Lund, line 3.
Ma'am, is your name Justine Time? Date of birth 7499?
Yeah!
Good enough for me? Now that we correctly identify the patients, now let's talk about our usual suspects displayed on the table. Nice and organized. We have our 5cc syringe with either a 21 gauge standard needle size or the baby 25 gauge needle. Be prepared for any size vein. If we have a small vein, then use a small gauge needle or butterfly. Use your best judgment to determine the needle size. Transfer the device to distribute the blood, then toss it. Vacutainer with an attached tub. Standard method for normal size veins. Oh, here comes MD Kirby with his lab orders. Please come in. Just giving lessons to the nation. Right on top of that, MD Kirby, a must-have heat pack. Bend this little seal. Shake it. Then it starts getting warm. Can't leave home without it. Alcohol pad to clean the skin. It will help highlight the veins. Whenever you use alcohol pads, keep wiping and pressing on the vein. Press more with your finger and you're making it pop out more. That vein will get irritated. I'd highly recommend that strategy. Cotton ball to cover the puncture site, putting pressure once the needle is out. Either you put pressure if the patient can't, or if the patient can, while you start labeling your vials. Try to prevent the bruising. Most of the time, you are going to use paper tape, but there are going to be patients, usually senior citizens, that are taking blood thinners such as aspirin, Plavix, Coumadin, Agrinox, Lovenox, Xarelto, just to name a few. The bleeding time is going to take longer. Platelets will clog up the punctured site, but delayed. Putting pressure helps. Wrap the coflex around the patient's arm snug so that the bandage can take control and stop the bleeding. Otherwise, the blood will start running down the patient's arm. The platelet's job is to plug up that site, to clog it up, and then hemostasis will be complete. Make it a habit of checking. Take off the bandage in about 10 to 15 minutes. Patients may request Coflex. They know their bodies better than we do. Be prepared to have both. Our first of 2 attempts of applying the tourniquet. Applying it more than 2 times is not necessary. Start over the clothing. Prevent the skin from pinching and make it snug and not too loose. Start to squeeze, moving the things around towards the AC. This squeezing technique to find the veins will help, making your job easy. The hardest part of phlebotomy is not being able to find that vein by not putting enough pressure. Then the job is going to be much easier. It still helps me. We're just squeezing all the way down to enlarge all the veins towards the AC area. The more options, the better. We can see the veins popping up just by squeezing, and it does make a difference. Take your time doing this, as the patient is doing okay. Continue until you pick your chosen vein. Whatever finger you feel with, that finger will be used exclusively to feel. Try what works for you. Don't press lightly. Get in there. If patients start to grunt or complain, do it more lightly. If you press lightly, It's not enough pressure because you need to wake up the vein. If the vein is deep inside, or if it's just going to be up to the surface, that's why you have to press firm, not light. This vein feels bouncy. This vein runs down the center. Now that we have chosen our vein, we are ready to release the tourniquet, the first of 2 attempts. Helicopter Herman is en route with their staff care package.
Reporting in position.
Incoming! Incoming!
Thanks, Helicopter Herman. Always on time. Our second and final application. Not too loose or we are going to waste our time. Tie him off just like that. Prepare the vein. How many vials are these? Chemistry and hematology. Nothing we can't handle. Order a draw from left to right. It's a lot of chemistry tubes. We have a big vein, no problem. We're going to choose this one. Start preparing the vein. Then once we start squeezing, start feeling the AC area. This vein is going to run across like this, and just continue to squeeze and don't stop squeezing. Highlight the AC area. Take our cotton ball, palm it, paper tape, slap it on the glove, rip our alcohol pad. I'm going to feel above the sites. Start cleaning and sanitizing the area. Once you press on it, it's sleeping, so wake it up. Irritate the vein. Just keep pressing on it. It grows and it will dilate. Once you're finished, clean your finger. Take our Vacutainer, uncap it, take our very first tube, feel once again above it, get the needle closer, then poke.
Ow!
2 important factors: stability of the patient's arm, stability of the needle. The arm can't move once the insertion of the needle begins. My right finger is against the forearm, along with the others resting on it. When I insert the tubes, the needle cannot go deeper. Needle stationary, Vacutainer steady. No movement in either one. Use the top of the left flange to insert. Keep filling up the tubes. Gently take it out. Keep Vacutainer still. Left index underneath the bottom right for withdrawal. Make sure that when you take it out, you're not taking the needle out slightly. It will take practice and time. Vein is straight. Flow is still great. And we're just going to continue, and remember, left index pushing underneath, right flange for withdrawal without moving the needle out. Not disturbing the needle whatsoever. Gently pulling it out. Just continue down the line for each tube. Keep that Vacutainer steady. The fingers are still planted on the patient's arm. Right index under the Vacutainer neck, not allowing the needle to penetrate while I withdraw. Holding the Vacutainer steady while I push the tube in. Left index holding down the left flange, keeping still, continuing to fill them up. Repeat the process. Invert the tubes. Tube in, needle still. Excellent. We're almost finished. The blood is still flowing. We're doing great, ladies and gentlemen. Try not to take that needle out once we take out the tube. Our last tube is going to be our lavender. Just continue to let it flow. Needle still is not moving, hand still is steady. Now with that finger, press up against the left bottom of the flange, taking it out, inverting it, putting the cotton ball over the needle, taking the needle straight out, activating the safety device, releasing the tourniquet, putting that pressure. Always put that pressure. As you label your specimens, the patient will put pressure. Make sure they stop bleeding. Double check. Slap the paper tape or Coflex and call it a day. And that's all she wrote. Thanks for watching. Click on the next video to learn more about phlebotomy.